What is mental health first aid? Here's a quick guide to what it is, when to use it, and a basic mental health first aid action plan. When we think of first aid, we think of the options we can use to help an injured person before professional medical treatment can be obtained. The aim is to preserve life, prevent further harm, promote recovery, and provide comfort to the person who is ill or injured. Mental health first aid is help offered to a person developing a mental health problem or a mental health crisis. The aim is to support the individual until appropriate treatment and support are received or until the crisis resolves. Mental health first aid is used to preserve life when a person may be a danger to self or others, reduce a situation or problem from becoming more serious, promote and enhance recovery, and provide comfort and support. Why is training in mental health first aid important? Mental health problems are common. Every year, 1 in 5 people is affected. Many people are not well informed about how to recognize mental health problems, how to respond, or what effective treatments are available. Lack of knowledge may be a barrier to assisting someone get the assistance they need. Many people with mental health problems do not seek help or delay seeking help. The longer one struggles with a condition, the more difficult their recovery can be. There is a stigma associated with mental health problems. It's common for individuals to avoid seeking help due to shame and concerns as to how others may see them. Sometimes people with mental health problems may not have the insight that they need help or may be unaware that help is available. When in crisis, it's difficult to see a solution. When you see someone that appears to be struggling, it's okay to approach the person and ask if they're okay. Just as in traditional first aid, the person should be approached with kindness, empathy, and caution. The goal is to see if there is anything you can do to assist them. Professional and other support services are typically available, and knowing which are available in your area is important. Not all crises result in calls to 911. However, in the event there is risk of harm to oneself or others, this may be essential. The National Crisis Hotline number 800-273-8255. They assist with finding resources to meet the individual's immediate needs. Remember the acronym ALGEE. Each stands for a step in the basic mental health first aid action plan. Action A is assess for risk of suicide or harm. Action L is listen non-judgmentally. Action G is give reassurances and information. Action E is encourage appropriate professional help when necessary. Action E is encourage self-help and other support strategies. Remember to be aware of both verbal and nonverbal language. Not every person you encounter may need any intervention. However, a kind word and caring approach can't hurt. Once you are able to find out what the person may need, if any help may be needed, encourage and assist the individual with making connections. If the person appears to be at risk of harming self or others, it's important to call emergency services, even if the individual does not want it. Never jump to conclusions. One person's crisis is not a crisis to others. When possible, stay with the person until other responders arrive, unless it would put you at risk to remain. Then, make sure you practice good self-care after. Please subscribe and follow for more content.